Everybody knows the problem facing Medicare, right? Too many damn baby boomers using it over the next decade or two, and not enough working people to pick up the tab. But you see, that's not really a problem with Medicare. It's a problem with the way Medicare is funded. Medicare's administrative costs are much lower than those of private insurers. Medicare doesn't have a sales force earning commissions. It doesn't need to advertise. It doesn't pay dividends to stockholders. It doesn't pay oversized executive salaries. And it doesn't pay lawyers to prove that any expensive claim arose from a pre-existing condition. It's been estimated that the administrative costs of the privates are 8 to 10 times the size of Medicare's. But even if the difference isn't that large, it's still substantial. Medicare is very efficient. It follows that if employers could buy health insurance for their workers from Medicare, it could cost them less than buying it from a private insurer. And Medicare would have a new source of income to augment payroll taxes. Yes, Medicare would have to expand its staff, but since the new people coming into the Medicare system would be younger and healthier than the people currently enrolled, the average cost in claims per enrollee would drop. Medicare would become even more efficient. The private insurers, of course, would be free to compete by improving their own efficiencies and cutting the cost of coverage. But wait, say the free marketeers among you, we can't have government horning in on the private sector. That's, gasp, socialism. Well, duh, boys and girls, Medicare is socialist. Whenever there's a real need in our society that the market won't meet because, like health care for the elderly, it just isn't profitable, we turn to socialism. And any time something our government does starts turning a profit, we privatize it. We privatize all the profits and socialize all the losses. Anybody who thinks our taxes are too high ought to see that just doesn't make sense. So come on, America. Why should government be the only business that's never allowed to turn a profit? If we want to save Medicare and hold down payroll taxes, the simplest way to do it is to let Medicare compete mano a mano with the private health insurers. And if the privates can't compete and we wind up with a single-payer system run by government, well, that's okay with me.